It was July when the Trump administration inexplicably took away the responsibility of tracking COVID hospitalizations from the CDC. What is it about the CDC you don't like so much? They took it away from the CDC. They gave the job instead to the Health and Human Services Department, which had no experience tracking that kind of complex and fast-moving data. Well, today, Science Magazine did a deep dive look at HHS's COVID hospitalization data, such as it is. They compared it to state-by-state data and other federal databases, basically to check to see if this crucial data collection the Trump administration wrestled away from CDC now reflects an accurate picture of COVID hospitalization crisis, of the COVID hospitalization crisis on the ground. Bottom line of what they found is that we shouldn't necessarily think of the data from HHS on COVID hospitalizations as like a science-based tool to track the availability of beds in the U.S. Instead, we should think of this data as garbage. A random, jumbled collection of numbers that doesn't reflect reality at all, at a time when it would be really good to have good data on this in particular. The headline at Science Magazine is a little bit more polite than I'm being. Their headline is this: Federal System for Tracking Hospital Beds and COVID-19 Patients Provides Questionable Data. Yes. One CDC employee summing it up for the magazine like this, quote, "The HHS Protect data are poor quality, inconsistent with state reports, and the analysis is slipshod." Because this administration has, for no reason, ruined data collection around COVID hospitalizations. Part of the challenge now is not just the scale of this problem and the number of states where they're running out of hospital beds and ICU beds to treat people. Part of the problem now, because of this failure by the Trump administration, is the fact that the government agency has been put in charge of telling us how big that problem is and where it's the worst. That agency can no longer be trusted to give us sound and useful information. This was a totally avoidable problem and a disaster that public health experts saw coming a mile away, including Laurie Garrett, Pulitzer Prize-winning science journalist, who at the time called this change in the data collection plans, quote, appalling. She said when they did this, that stripping the CDC of its role in collecting this information would make this data, quote, now useless. She was right. Joining us now is Laurie Garrett. She is a health policy analyst and Pulitzer Prize-winning science writer who has been a real voice of reason for us over the course of this crisis. Laurie, it's really nice to see you. Thank you for being here.
Pleasure.
So you and a lot of other public health experts really called this back in the summer when the White House decided they were going to take this away from CDC and have the Trump administration, have HHS collect this data. Instead, it really does seem to have been borne out in the months since. How big a problem is this? How much better off would we be if we had real data we could count on?
Well, first of all, Rachel, we really all owe a great debt of gratitude to Charles Piller, who has doggedly covered this story for Science Magazine for the last 3 months, performed brilliantly. And one of the really important things that he has, all of a sudden, you are coming on my television, for which I apologize. He has doggedly done his job, and one of the things that he revealed was that Deborah Birx was really behind this. She wanted more control of the data. She didn't trust CDC and claimed that the data was sloppy. By moving it into HHS, they actually then farmed it out to 2 private companies. One was a private firm called Teletracking, biggest client they'd ever had, and the other was Palantir, which, of course, not much later went public on the stock market, and Palantir was engaged to sort of massage and analyze the data. The result was, of course, that the hospitals were thoroughly confused. Who are we supposed to send data to? What forms are we supposed to fill out? How do we do this? What computers are we supposed to use? And for a long time in the summer, right after this all started, we really had almost no data really to rely upon at all. Eventually, the federal government started really pushing the hospitals around and said, you're going to lose your Medicare contracts. We're going to take your Medicaid and Medicare patients and throw them at another hospital if you don't start reporting data to us. Whoa. All right. So all the hospitals start flooding data in. But what's the reliability of it, the relevance of it? What does it really mean? Now, here's where the crux of the problem is. If your job is to decide how much PPE needs to go to Arkansas, or how much dexamethasone needs to go to South Dakota. If your job is managing the national stockpile and determining whether or not we're heading to a crisis level of shortages of protective gear for nurses, for example, you need to know what's the hospitalization rate? What do the trends look like? What's the use rate? Well, you don't have any such data to rely on right now. It's just a total mess. There's no, and it's a mess at all levels. The federal numbers don't jive with the state numbers. The state numbers don't jive with the county numbers. The private hospital sector is reporting a different way than the public hospital sector. I mean, this is just chaos.